So I think my PD time can be summed up probably in three distinct areas: nutrition, health disparities, and within that global health, and then diversity, equity, and inclusion work. Nutritionally, I have always had this dream of culinary training, and so I actually went and got my culinary certification during my PD time, which I know is a bit non-traditional. I also got a plant-based nutrition certification, and so what I've been doing with that is a couple of things. I have worked with a number of dietitians at Stanford Healthcare, as well as the Stanford Healthcare Food Services leadership team, to make some changes to inpatient menus in terms of making them better tasting, more plant forward. So that's one way that I've used that. And then I also teach a number of nutrition classes through hands-on cooking. And I do that through the medical school, through something called the Stanford Teaching Kitchen, which was started by Dr. Michelle Hauser. And then I also teach a number of classes through Stanford Be Well and GME, such as Women in Medicine, as well as the plant study at Stanford. So a lot of different venues, but mostly focused on teaching providers and patients about eating well for themselves and for the environment. So I get the question about the connection between surgery and nutrition a lot. I think most people are pretty surprised when they hear that I wanted to spend time becoming a chef. I feel that nutrition is really integral in our work, so a number of the disease processes that we work with actually have nutrition as a risk factor, poor nutrition as a risk factor. Nutritional status also really strongly impacts recovery and complication rate in surgery. So when you think of things like infection rates or anastomotic leaks, that's very much impacted by a patient's nutritional status. We know that someone's recovery rate can be impacted by their nutritional status as well as their physical activity. So lifestyle medicine in general is an interest of mine. And then I'm also really interested in this area of really using the opportunity of diagnosis, surgery, and hospitalization as a teachable moment. So really using that chance, that window, to impact long-term behavior change in patients. The health disparities work that I've done, so I have worked on trying to organize and increase the number of opportunities for surgical trainees that are interested in working in areas of health disparities, and that has a pretty broad definition. And so one of the things we've been working on is incorporating more formal education on health disparities into our curriculum, so into our core course time, and that's available to all surgery residents. But then additional opportunities for those who want to get further training or education in that. So that may be getting involved in local pipeline programs with high schools. It may be rotating abroad in a lower resource setting, so clinical rotation. It may be quality improvement work or research. And so that's what I've been doing there. And as part of that, I have been able to go to Rwanda to work at the University of Global Health Equity, doing some medical education in their medical school with students on their surgical rotation. And then separately, I've also gotten really involved in a nonprofit that provides surgical care in Guatemala called Hospital de la Familia. And then the last thing is diversity, equity, and inclusion. And so I'm part of the JEDI Council, which is within our Department of Surgery. And then I also am part of the Lead Scholars Program, which is available more broadly through Stanford GME and provides leadership training in DEI work for physicians. I see a link between all three of these areas, but I definitely have worked with different faculty on all three, and I've utilized different funding resources and different communities to collaborate within Stanford. So it definitely is a lot of balancing. It's a balancing act, but I think it is possible if you have diverse interests. I think your PD time is really the time to make that happen. And so I would say for me is a combination of applying to formal programs like the Lead Scholars Program that I mentioned, but it also is, finding your own way, creating your own path, which is really what I think your PD time is about, is finding your own niche. I got funding through a number of different sources to cover different aspects of my PD time. And so like many of the other residents that have probably been interviewed here, the Professional Development Research Award for general surgery residents is something that I applied for and was rewarded for 2 years. And so that basically has covered my salary. And then I also applied for the Li Ka-shing Surgeon Scholars Program. And this is something I actually didn't mention, but that is covering my master's degree. So I'm currently getting a master's in community health and prevention research. And so that scholarship program is very specifically geared towards helping surgical trainees get additional education in graduate programs, if that's something that will support their interests and their goals. And then lastly, I applied for, myself and Dr. Cindy Kin, who's one of our colorectal surgery attendings, applied for a plant-based diet initiative seed grant here at Stanford, which is not specific to our surgical department, it's the broader Stanford community, but that has helped to provide some project funding. I think that the PD time has been a real opportunity to return to some of my other passions outside of surgery, but find a way to connect them to my surgical career. And so I think, my interest in culinary medicine and lifestyle medicine is a bit of a new or uncharted area within surgery. But I think these 2 years have really allowed me to start to establish myself as someone who can lead in that area in terms of getting further education and training and having some tangible products or projects and outcomes or deliverables associated with that, such as the menu changes. And so I do see myself continuing my culinary medicine work in my career. I see this in the form of teaching medical students and physicians and other healthcare professionals, as well as patients, about nutrition through cooking classes, but also being involved in the food that we serve patients and staff in the hospital, because that's a huge amount of food that basically is prepared and served every day. So a huge opportunity for impact in terms of working in a hospital system. And I guess I'm open to seeing where else it takes me. And then in terms of a surgical subspecialty, I'm still deciding. I'm undecided right now what I'd like to do after general surgery. I really love general surgery, so I would like general surgery to be part of my practice. And then another thing I kind of got interested in during professional development time is really the overlap between surgical specialties and palliative medicine, and really establishing those deep relationships with patients and understanding their goals, and especially when they have really serious disease or at the end of their life, and having some of those difficult conversations, as well as helping to manage their symptoms. And so I've gotten interested in that overlap as well. I was a medical student at Stanford, so when I was making my rank list, I ranked Stanford #1, and I wanted to stay here, I would say, primarily because of the community that I had developed here as a medical student. I had such a great experience, and I'm really happy to say that I've been able to strengthen as well as grow that community during residency, and that even extends beyond the Department of Surgery. I think one thing that was a big draw for me is that Stanford is part of this larger campus. And there's so many other things that are going on. And so especially if you have unique interests or you're hoping to combine or overlap two different fields, like in my situation, it's a great place to be for that, because there's so many opportunities for collaboration and innovation, and a lot of resources if you're willing to look for them. And so I think that was probably the main reason. But the weather doesn't hurt. And the access to just world-class outdoor activities definitely doesn't hurt, especially when you're working the long hours that a surgery resident does. And then I also met my partner here during my intern year. So it didn't go into my decision to choose the residency, but it was definitely a big perk of doing residency here.